Hello guys, welcome to my YouTube channel. My name is Friday Raymond Moore, and in this lecture we are going to discuss how you are supposed to write the general nursing management in medicine and medical nursing. So please, one thing you need to understand is that when you are writing the nursing management, you are expected to write the objectives, or rather the aims, and the aims in an exam, it is only 2 marks. So what are some of the aims that you can write in general nursing management under medical conditions? So let's take a start. So the first aims that you can write, aims are the first things. The first one you can simply say to allay patient anxiety, or if you want, you can simply say to allay the patient from anxiety. Now, one thing that is very much cardinal is that we want the anxiety of the client to be relieved. So this aim, you are going to see how it applies and how we actually allay the anxiety of the client. And the other aim that you can simply write is to promote quick recovery. So the reason why we're simply saying that to promote quick recovery is that we want the client to actually recover in a short space of time. So the first thing you're supposed to write under the nursing management in medicine are the 2 aims. And these aims, they are only 2%. After the aims, we go to the environment. Now, what are some of the points that you're supposed to write under the environment? So after aims, we move on to the next heading, that is the environment. Now please, one thing that you need to understand is that the environment is the place where you are going to be nursing this client, and this client has a medical illness. So under the environment, the first thing that you're supposed to write is the area of admission. Is it in male or female medical ward? So the first thing under the environment is the area of admission. So after you write the area of admission, you are simply going to talk about where are you going to be nursing this client. Is it in male or female medical ward? That is the area of admission. And please always remember to write the reason why you are nursing the client in that place of environment. Then after that, you talk about the location. Now, the location here, we are simply saying, are you going to be nursing the client in acute bay or subacute or side ward? That is the location which you are going to talk about. Is it acute? Are you going to nurse the client in acute bay? Is it subacute? Is it side ward? Okay, and always remember to give a rationale why you are nursing the client in acute or subacute or side ward. Because if you don't write the rationale, the examiner will not score you. Then the other point that you're supposed to write under the environment is the cleanliness of the area where you're nursing this client. Okay, so we talk about the hygiene, that is the cleanliness of the environment where you're nursing the patient. Now, most students, they love to write to say, I will nurse the client in a clean environment. Now, when you say, I will nurse the client in a clean environment, you are not stating to say whether you're going to be cleaning the environment while the patient has been admitted or you have already nursed the client. However, you can simply say, I will nurse the patient in the environment whose floor has already been mopped by the hygienic technicians with G26, window sills, lockers, and bed rails dam dusted by me to prevent nosocomial infection, because that is the duty you are going to do as a nurse. So that is how you can write under the cleanliness in environment. Then after that, you talk about the equipment. And this equipment that we're simply talking about is what equipment are you going to mobilize in the client where you're in the place where you're going to be nursing this patient. And this equipment, they include a working suction machine, a working oxygen cylinder, vital signs tray for checking and recording temperature, pulse, respiration and blood pressure, and so on and so forth. So please, when you mention the name of an equipment, make sure you give a reason and the use of that same equipment you are talking about. Then after that, you can talk about now ventilation. After the equipment, you can talk about the ventilation. Make sure you say, I'll nurse the client in an environment which has got good ventilation to allow circulation of fresh air. Then last point under the environment, you talk about lighting. Now, lighting, this is where you're going to talk about nursing the patient in the environment which has got good light, so that you are able to see the client and observe the patient in an appropriate manner. Imagine if you're nursing the client in an environment where there is no proper light, you can injure the patient and you cannot take care of the client in an appropriate way. So after the environment, we move on to the next heading. So I'll have to wrap here. So the next heading after the environment, we have, so we say heading number 3, we have the position. It's in blue. So what point are you supposed to write under the position? Number 1, remember to say when a patient has been admitted, it is the duty of you as a nurse to position the client. Of course, there are some cases where the patient might want to resume the position of comfort, but there is no comfortable position. Therefore, when you're writing in an exam, don't say, I will nurse the client in a comfortable position, because there is no comfortable position. That's the reason why we tend when we are sleeping in bed in the evening, at night, sorry. So, what point are you supposed to write under the position? So you can simply say, number 1 is turning the patient. Turning the patient every after 2 hours to prevent pressure sores formation. And you can also talk about nursing the client in semi-flawless position to allow full lung expansion. You can talk about nursing the client in semi-flawless position to allow full lung expansion. Then after that, after the position, we move on to the next heading, that is observation. So under the observation, what point will you talk about? So in observation, this is where you're going to observe the patient. And one cardinal point is that the first bullet that you need to talk about, you need to observe. You observe the general condition, that is the GC, the general condition of patient, in order to see if it's improving or not. So you're supposed to observe the general condition of the patient in order for you to see if the condition is improving or not. Then after that, you can now observe the vital signs. Please, vital signs, I mean temperature, pulse, respiration, and blood pressure. So when you are writing under the observation, if the client has got a condition where the temperature is high, in that situation, you need to clarify to say, in this case, the patient will have hyperthermia because of infection. Therefore, what will you do when the patient has got hyperthermia? So talk about the things, the interventions that you are going to do when the patient has got high temperature. And if the patient has got tachycardia, explain the interventions that you are going to do in that situation under the observation. Same applies to respiration and the blood pressure. So those are the points you can talk about. Those are some of the few points you can talk about in observation. After observation, we have number 5. So we need again to rub here. After the observation, we have number 5 bullets. And this one we talk about psychological care. So the number 5, it is psychological care. Now, the psychological care, this is the place, or this is where you're going to actually allay the anxiety of the client. So what bullet are you supposed to explain under psychological care? The first bullet is supposed to say you need to tell the client the condition or the disorder that they have in a language that they can understand fully, so that you can allay anxiety and you clear the misconception that the patient might have on the condition. So by explaining or by telling the client the disorder that they have, you are allaying anxiety in the client. Then apart from that, you can also ask the patient if there are any questions, and you answer all questions and you refer those difficult questions to your senior members of staff in order to clear misconception about the condition. You're also expected to explain any procedure before doing it on the patient so that you can gain cooperation from the client, because if you just start doing the procedure on the patient might refuse. Therefore, it is very much important that you get the permission from the patient so that you can get cooperation from the client. After psychological care, we have the next heading, that is nutrition. Nutrition and fluid. So please, under nutrition and fluid, this is where you're going to talk about the food that you'll be serving the client. So under nutrition and fluid, I can give you an example. This is, in this heading, you can simply talk about, I will serve the patient food which are rich in carbohydrate, like nshima or rice, in order to provide the energy that the client requires in metabolic reaction. Then you also say, I will serve the patient food which are rich in proteins like eggs and fish in order to repair worn out tissues. I will serve the food which are rich in vitamins like fruits in order to strengthen the immunity of the patient. That's how you're supposed to write under nutrition and fluid. Then you can also talk about, I will administer fluid in order to prevent constipation. Then after nutrition and fluid, someone has to go in elimination. So that takes us to point number 7, elimination. So what bullet are you supposed to write under elimination? So under elimination, you observe the bowel sound, the bowel movement, sorry. Then you also check the fluid input and urine output in order to detect early renal failure, because some clients, when you infuse in fluid, you're going to find out that they have dysuria or anuria, and as a result of that, that indicates that the client can have a kidney failure. Then after elimination, it takes us to point number 8, where you write hygiene. So under hygiene, this is where you talk about bathing the patient in order to remove dead epithelium tissue. Then you also talk about cutting the long nails of the patient short in order to prevent cross-infection. This is where you talk about changing soiled or wet linen in order to promote comfort and prevent harboring of infection on wet linen. That is under hygiene. Then after hygiene, we go to point number 9, which is infection prevention. So please, infection prevention is very much cardinal. Don't forget to write this bullet. This is where you talk about you wash your hands before and after touching the patient in order to prevent cross-infection. This is also where you're going to administer prophylaxis antibiotics, such as Cristapen, 2.4 mega unit, in order to prevent bacterial infection. You can also talk about removing wet or soiled linen to prevent harboring of infection. You can also talk about what's this? Okay, those are the points that you can talk about under infection prevention and so on and so forth. Then after that, you can talk about point number 10, which will say about exercises. So under exercises, this is where you say, I will exercise the limbs of the patient in order to prevent contractures and promote blood circulation. And you also say, I will teach the patient how to breathe in deeply and breathe out slowly in order to allow oxygenation in the air sac. That is under exercise, and some other exercise that you can talk about. Then after that point, we go to the next heading where we'll talk about rest. So after exercises, we go to the number 11 where you talk about rest. So under rest, this is where you simply do related procedures in blocks in order to avoid disturbing the client. This is also where you're going to mount a post which will say, or which will indicate to say, silent please, in order to prevent the visitors from making noise on the ward. Then you can as well discourage visitors from coming to see the client when the patient is sleeping to avoid disturbance. You can also reduce the volume on the television set or on the radio to avoid noise, thereby promoting rest and other things that you can talk about. Then last point, you talk about the medication. Now, under the medication, they are not asking you to go and write the name of the drug, the dose, the side effect, nursing implication. No. Under medication, a classical example that I can give you, you can just simply say, I will administer prescribed drugs such as paracetamol 1 gram in order to relieve the patient from pain. Then you can also say, I will observe adverse side effect of paracetamol such as hepatic failure, and if signs and symptoms occur, I will discontinue the drug and inform the doctor. So these are the points that you're supposed to write under the general nursing management in medicine. Now, the last bullet is, what are some of the IEC headings that you can talk about in medicine and medical nursing? So make sure that you subscribe to my YouTube channel, and in my next video, I'll talk about some of the general IEC that you can write in medicine and medical nursing. Thank you so much, and God bless you.